Good day, everyone. I'm Dr. John Ward. I'm the director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health here in the United States. Thank you for joining our webinar today, Accelerating Hepatitis B Birth Dose Introduction in Africa, Country Experiences, Advocacy Successes, and Lessons for Scale-Up. This is part of our activities that we have underway for a number of years to work with civil society organizations in Africa to increase the awareness of the burden of hepatitis B, the negative health consequences of the chronic hepatitis B infection leading to end-stage liver disease and liver cancer, and the role of civil society organizations in educating the public, clinicians, and policymakers regarding the benefits of timely hepatitis B birth dose vaccination. So thank you again for joining us. Next slide, please. You'll be hearing from a number of speakers that we'll be introducing here shortly. Please submit your questions to them in the Q&A. We'll encourage them to respond to them as they can, and then we will seek to highlight as many as we can in our discussion period. The webinar is recorded and posted on our website at globalhep.org, along with our other webinar series. And while you're on our site, I encourage you to sign up for our monthly newsletter so you can get the latest of what we're doing, including future webinars. Next slide. We've now produced over 60 webinars on a variety of topics related to hepatitis B and hepatitis C elimination. We have a number of those include other webinars focusing on activities of civil society organizations to increase education and leading to policy change for hepatitis B birth dose vaccination in their countries. So I encourage you to go and learn from those other webinars, as well as the other educational opportunities in that webinar series that are available. Thank you. Next slide. So for our agenda today, and I'll be turning over in a moment to my colleague Quincy Williams to introduce these different speakers, but you'll be hearing from the activities in Sierra Leone and Ghana, Tanzania, Kenya, Nigeria, and Zambia. Next slide, please. So as I mentioned, you'll be hearing from Quincy here in just a moment. What we're dealing with is that hepatitis B is a major global health problem. About 240 million persons are infected with hepatitis B. The greatest risk is for a chronic hepatitis B infection is for newborns who are infected at the time of birth through exposures to the blood during birth. And then once infected, newborns have a 90% risk of remaining infected and 1 in 4 risk of dying early in life from the liver disease caused by hepatitis B infection. And as you can see, the African region has 64 million persons living with chronic hepatitis B. We're seeking to prevent transmission so that prevalence begins to decline over time. And we have a major project underway known as Center for Operational Research on Hepatitis B, or core HepB, to expand access to testing and treatment for persons already infected in Africa. And I encourage you to go to our website, corehepb.org, to learn more about those activities. Next slide, please. Hepatitis B is a cause of most hepatocellular carcinoma around the world. At least 50% of the liver cancer in Africa is caused by hepatitis B. So hepatitis B vaccination was the world's first cancer-preventing vaccine. And so by preventing infection with hepatitis B and chronic infection, you prevent liver cancer. So it's a major health benefit that has to start within that first day of life. Next slide, please. Hepatitis B vaccine is tremendously effective. The 3-dose series provides about 95% effectiveness in preventing hepatitis B infection, and that protection is long-lasting. From a study that just was released several weeks ago from Alaska here in the United States, following people that were vaccinated as children, it was estimated protection was long-lasting as least 41 years after the vaccination series. So newborn infant vaccination protects people through their adolescent and into their adult years. So huge public health benefit. Next slide, please. Through the scale up and increasing the number of children vaccinated with hepatitis B vaccine to prevent chronic hepatitis B infection, this has been a major public health benefit. As you can see here, an estimated 22 million deaths have been averted through the hepatitis B vaccination of children. That number can grow if we continue to increase coverage to an estimated 38 million by 2030. And that's public health impact is second only to measles vaccination. So a huge public health benefit that we're trying to make available to every child in Africa, thanks to the work of the civil society organizations you'll be hearing from here in just a moment. Next slide, please. Because of the increasing coverage of vaccination of infants as part of the routine infant immunization schedule, where you have combination vaccines that include hepatitis B, transmission to infants has been greatly reduced because of the high vaccination coverage of infants. So as a result, an increasing proportion of new chronic infections are related to transmission at the time of birth. And so that's why the birth dose vaccination is increasingly important, particularly in Africa. Next slide, please. To fully eliminate the risk of mother-to-child transmission, hepatitis B vaccination is the foundation. Other interventions, screening the mother to identify those that are infected with hepatitis B is very important, helps to prioritize and make sure that infant receives that timely birth dose vaccine within the first day of life. And then other interventions can be made available too, such as antiviral prophylaxis for the infected mother, particularly those that have high viral loads of hepatitis B. Next slide, please. What we're seeking to correct is the challenge that Africa, when you look at all the WHO regions around the world, the WHO Africa region has the lowest coverage of hepatitis B birth dose vaccination, with less than 1 out of every 5 newborns receiving a dose of hepatitis B vaccine within the first day of life, and with many countries not yet having a policy for routine hepatitis B birth dose vaccination. Next slide, please. And as a result, 2 out of every 3 new chronic hepatitis B infections are among children in Africa because of this low immunization coverage. Next slide, please. Now, if we can improve that coverage, we can avert over 500,000 deaths from liver failure and liver cancer caused by hepatitis B when we protect the children in Africa with a timely birth dose vaccination. And that's what we're seeking to bring about today collectively with our partners that you'll be hearing from here on today's webinar. Fortunately, Gavi, the Vaccine Alliance, several years ago approved support for countries to begin to routinely vaccinate children born in birthing facilities with a birth dose of hepatitis B vaccination. And so countries are beginning to apply for that support to Gavi, which will be a great stimulus for countries to move toward making this vaccine more widely available to their newborns. Next slide, please. Fortunately, about so far 12 countries have applied for this Gavi support. In Africa, other countries shown on the left are eligible and are some of which are moving toward developing those proposals. And Gavi, in speaking with them, believes that the great majority of these countries that are eligible will move toward getting some support for birth dose vaccination in the next several years. So that's really a positive development that we wanted to share with all of you on the webinar today. Next slide, please.
Thanks, Dr.
Okay, go ahead. Go ahead, Quincy.
Thank you. Thanks, Dr. Ward. So our project goal is to invest in local civil society organizations in Africa to promote timely Hep B birth dose vaccination, ideally within 24 hours of delivery. So since 2022, this project has collaborated with 23 African civil society organizations across 12 countries. Our project target audience includes political leaders and policymakers, healthcare providers, especially those working in the maternal and healthcare provider fields, and traditional birth attendants, community leaders and health officials, and lastly, the general public, particularly pregnant persons and women of childbearing ages and their families. Next slide, please. So just to give a little bit of spotlight on some of the project activities, the main one is community awareness. So of course that includes public education campaigns, radio and social media and community outreach, and culturally adapted messaging. Two, we have advocacy and policy change with an audience or working with the ministries of health and parliamentary and stakeholder outreach, developing policy briefs and advocacy materials, and those are supporting the introduction of Hep B birth dose within the respective country. Next, we have coalition and capacity building. So that's the National Hepatitis Coalition Development, CSO training and technical assistance, and healthcare worker education. And lastly, we have program implementation and sustainability. So supporting Hep B birth dose rollout and evaluation and integrating this vaccine with other newborn immunization platforms. Next slide, please. So as you can see, this is a little bit of map of the countries that we've worked in since 2022. And as you can see, we like to add on to those countries each year. So as Dr. Ward mentioned, this year we've worked with Ghana, Kenya, Nigeria, Sierra Leone, Tanzania, and Zambia. And I will shortly introduce our first country spotlight of Sierra Leone. Next slide, please. So I will have Michael Jones of the Expanded Program on Immunization, part of the Ministry of Health in Sierra Leone, and the partnering CSO Focus 1000, represented by Mohammed Jella, to give their presentation on their recent Gavi application and then their opportunity for a successful rollout. So Mohammed, please. You may be on mute.
All right, Quincy, thank you so much and for this opportunity created. And I'm Michael Jones, and I have here Dr. Mohammed Jallow. Dr. Mohammed Jallow, you could go ahead and introduce.
Yeah, good morning. My name is Mohammed Jallow. I'm the Chief Executive Officer and founder of Focus 1000, and we are very happy to be here. You know, we work very closely with the Ministry of Health, and I have my colleague here, Michael Jones, who is a senior programmer in the Ministry of Health in the Expanded Program on Immunization. So we're happy to be on this webinar, and Michael will start with the presentation, and I will come in later on. Thank you very much. Over to you, Michael.
All right, thank you, Mr. Jallow, for this presentation. Just run through quick the slides. The birth dose vaccine introduction in Sierra Leone, moving from approval to implementation. Next slide. Next slide, please. Right, so wanted to lay the background basis. Even though 300 million people are living with hepatitis B, and we have 1.5 million are dying of complicated viral hepatitis, which include liver cancer. In Sierra Leone, the prevalence for hepatitis B is 13.8%, which gives you 1.1 million of the population out of the 8 million population, and means 1 of 8 individuals are positive of it. And age category for the positivity of this disease is around 30 to 44 years, and this is 6.6%. 5 of the 16 districts, and in Zambia, the 50% of the hepatitis and then be pardoned. And then if you can see it ranges from the west to on the map, from the west to and then the northern part, and few on the south part of the country. And we have special groups that we want to talk about. Healthcare workers is 10%, and among the pregnant women, 11.3%, 15.2% among blood donors, 16.7% in school age children, 21.7% in people living with AIDS, and 1.3% in children between the age 4 to 30 months. Special population articles have been published, which you will see there that in a zero prevalence and study that was done, an article published, you find out that 6.20% of pregnant women are positive, and this is in 2005. Another one which was done in 2022, you'll find out that 18.8 pregnant women, whereas I said they're positive. And of course, the recent one is in 2023. Next slide, please. Next slide, please. Next slide, please.
Apologies, there might be a delay. We have the slide up. Sierra Leone received final decision letter from Gavi on May 26th.
All right, so we received a decision letter from Gavi on the 26th of May 2026. And in that decision letter, VIG grant was
Excuse me, Michael, maybe Michael is having some problems, because in China.
Let's reach into this decision later. And that we had in 2026, we started the whole process of the application in 2023, and the country expressed an interest and to introduce this vaccine. Then, of course, immediately in 2024, in January, we established a technical working group and with 6 subgroups. Then, of course, we did DEX review of the country's publications in July of that same 2024. Then we conducted a technical workshop where we bring in experts to come and develop the application, and then which is in August 2024. Then in August, the same month, we map and engage stakeholders after we've got the technical experts, and then we presented what we've documented so far. Then, of course, they've given their feedbacks and their inputs and commitments were made by various keys. Secured NITAG recommendation in September, then followed by the ICC approval. Then, of course, we submit the application on the 17th of September to Gavi. And then, of course, after that, then, of course, you have IRC feedback that comes out, and, of course, which we address this and provide response in 2025. Next slide, please. Next slide, please. All right.
Slide showing, yes.
This one shows the roadmap of how we've started. You see that from this, you see that we've started with the development of communication strategy. And of course, we also have gone through to the review and updating of tools. And of course, we've conducted the first readiness assessment. And then these are critical milestones that I'm showing on this side. We'll find out that those in red are not yet started. And of course, the plan is that in August, we are hoping to move forward. Thank you. We're hoping to move forward with We're open to move forward with the clearance from pharmacy board, then of course, printing of tools, vaccine arrival, then of course, we then move on to and then transfer of funds to the districts, and of course, integrated bundle distributions from national to district. Then of course, we'll definitely do final training and health facility, which, and then we'll do it for the introduction. Then of course, we'll do integrated vaccine distribution last mile. Then in November, we plan to do the launch and rollout. Then of course, this will follow by supervision and monitoring. Then of course, in 2027, we'll then have the post-introduction evaluation, which will be conducted. Next slide, please.
Now showing key opportunities.
So we want to look at the key opportunities for a successful implementation of the back-dose vaccine. What's one thing we've seen is that there is a MOHS leadership and commitment. And this we've seen that there is a buy-in and support for the elimination of HepB by 2030. There is a national viral hepatitis strategic plan which has been developed, and then the ministry has endorsed it for 2023 to 2030. We also have conducted a triple elimination. We've launched it, and then which includes the HepB syphilis, and of course, and HIV, and then this has been implemented in facilities. There's also needs for is constructive coordination and integration of health care services at all levels. So what we've seen is that the integration within EPI activities and structures and child health intervention, that's what the plan is, the opportunity is there. And then of course, early partner support ahead of the Gavi decision letter and funds transfer. So we've, as part of what we've done, the Gavi decision letter and the funds transfer is a key part. Then, of course, the existing EPI structures, which developed during the application process, is an opportunity. We've set up technical working group way back when we are developing the application. Then, of course, the other thing we've seen here is the competent and trusted health workforce at national and subnational level. This is a key opportunity that well and vast experienced staff, and then on new vaccine introduction, and then of course the country has 11 antigens that's already been introduced into the routine successfully. And of course we have a deployed and then community health workers that conduct household visits and community engagement. So this is a clear opportunity for the HepB-BD rollouts to be successful. Next slide, please. So to continue with the opportunities, we've also have got continuous collaborative engagements and partnership with immunization stakeholders and partners and the private sector. So one thing we've done so far, and then we've started a public-private and partnership engagement with private health facilities. And then this started way back last year. And this is a very, very clear opportunity that we were able to integrate the private hospitals into the rollout of the HepB vaccine. We already have got existing CSOs, Focus 1000, Red Cross, and Health for All Coalition in the immunization space. And then these CSOs that you've seen, they have structures at community level. I can mention the Combined Network from and the Focus 1000. Red Cross also have their chiefdom coordinators. And if we want to reach down to community level with messages, these structures are already there. We have got adequate and earlier stakeholders' involvement from the development of the application, wherein stakeholders have given us their recommendations on how we can roll out successfully and also made commitments towards this. And we believe that this recommendation will guide us towards a successful and stakeholder ownership and for EPI interventions. And this has been demonstrated way back in also previous EPI and interventions that have happened. We also have got community bylaws against home deliveries, which will strengthen institutional deliveries. So those bylaws will make sure that people will come in and deliver at the health facility. And then lastly, we've got earlier data planning and sustainable coverages. The country current BCG and administrative coverage is above 90% and serves as a stepping stone for the HepB-BD and vaccine routinization. And what we also have done so far, We've tried as best as possible since last year that we have got the HB-BD vaccine into the health facility monthly data collection tools. And then, of course, it has also already been included into the HMIS, which is the DHIS tool. Next slide, please. Next slide.
Key challenges slide is.
All right, so these are key challenges that we've been experiencing, or we've seen that these are challenges that will happen, and we've already have developed a plan, mitigation plans and actions. And then we find out that the plan was to introduce HB-BD in 2025. But then now we are in 2026. This has changed. There's been a change in the live birth population, and this will have affected the change in the vaccines, and that's like materials needed. And there is a change in the prices of critical budget cost drivers like fuel and transport, and then which we think also these will also affect. These are critical challenges we will envisage, especially when we want to introduce using the vaccine budget that we used to apply. And of course, the approved VIG budget is not even realistic as of now for introduction. Consider these changes in the prices and also these changes and then that has happened also with the target population. So what's the plan is? We've revised the VIG budget and we have identified the gaps. And then we've also think that one key solution in some of those gaps is to integrate with other EPI activities and child health activities so that we can able to have a successful rollout. Well, of course, we also see that we're definitely going to do resource mobilization for partners, and we're also definitely going to ask the government to come in to support in those budget gaps identified. Then, of course, we will look at how we can engage Gavi and then to request for additional vaccine support since the change in the country and then targeted population. Then we also think that one of the challenges that comes in from based on the CAP survey and other things that we've seen, there is a little and limited public knowledge about hepatitis B. So what we've done, we've got earlier training and orientation of healthcare workers, which we recently have conducted with the support from the task force. And then, of course, this we've seen that, yes, people do lack knowledge of it. Then, of course, we have provided orientation for CHWs. And then we started this in Zambia and then Port Loko district. Our plan is to make sure that we scale up on this and then in other districts. We think that also media engagement is critical in terms of let people aware, the print, electronics media, the social media, the handlers should also be utilized to make sure that people know about it. Community engagement, we believe that community meetings and town criers and announcements in the various community level should be done for people to also know about this. And of course, we also have noticed in Sierra Leone that kids, children, pupils, and students, they are the fastest people that can take information faster to the parents. And we believe we should engage the teachers and the pupils and them students in the various learning institutions. Next slide, please.
Thematic activities.
Right, so I've just listed thematic activities that we've done so far. We are happy that the task force was able to support the EPI and them in moving this, and we are proud that this was one key that's pushed in terms of the meeting and the engagement of this. So the leadership and coordination and then thematic aspects, we have reactivated the National Technical Working Group, and then I've got like 2 or 3 meetings, and the sub-thematic groups, 6 sub-thematic groups have also been reactivated, and they are meeting. And then the technical working group is meeting bi-weekly. The sub-thematic groups are meeting a week before the sub-technical working group. TORs have been developed and membership mapped, and while we have identified critical members in all of the subgroups and also on the technical working group. We have reviewed the vaccine introduction grant budget and identified the gaps. And of course, the implementation timeline has been revised. We've given the opportunity to the subgroups to revise the implementation timelines and make sure that this is aligned to the national timelines. On social mobilization and demand generation, we've integratedly, because of even the funds are not available, we integratedly conducted a CAP survey whilst we are doing our routine immunization and then CAP survey. We integrated the HepB components and into it, and also we do and also want to know something about the HepB-BD vaccine. And this is conducted in 6 districts. Communication and crisis messages have been developed. They have been reviewed, and implementation planning for these messages has been also developed and approved by the subgroups. Frequent asked questions for the HepB-BD has been developed and reviewed by sub-technical working group, and the national technical body has reviewed these messages and provide feedback. Then on service delivery, the HepB-BD was integrated with the immunization in practice. So this is a new approach we introduced, because mostly our trainings are done towards the end of towards the introduction, close to the introduction. But this time around, we decided to integrate and then the HepB-BD into the immunization in practice, IIP, and reach every child and them training. And in that training, we, as best as possible, we trained TOT, national training of trainers was conducted for 3 days, and we have 50 participants who are trained as national supervisors. District TOT was also conducted for DHMT staff, and 40 people were trained from the DHMT. Chiefdom supervisors were also trained, and then which was 112. You can see the number there. And what's unique in this training that we had is that we invited maternity and labor ward in charges from government hospitals and the private and the hospitals in Sierra Leone. And what we did is that 50 facilities were part of this training in the 8 districts that we have conducted this training. And we have also gone down even to the facility level. And we're in 4 districts, we've tried as best as possible to make sure that 282 were there. We've gone on monitoring and evaluation. We've done readiness assessments, which was done by immunization partners. And of course, 76% national readiness was identified, and 28 out of 37 targeted activities were achieved. Next slide, please.
Hi, Michael. If we could quickly transition to Mohammed, so he has a couple of minutes to speak on his project, please.
Yes, you can go ahead.
Thank you. Maybe let's advance to Focus 1000 slides. Thank you. Mohammed, please go ahead.
Thank you very much. I try to make it as short as possible because I think Michael has covered, very good ground. So let us go to the next slide, please. Yeah, so for us, Focus 1000 is one of the civil society organizations. Our first experience is that, lesson learned is it is always the best to work with the government. As Michael mentioned, the leadership of the government makes a big difference. So what we do as Focus 1000 is to work with government, other partners, private sector, and other CSOs. And we've used an approach of, first assessing where we are. Then next, we do the preparation, of bringing in other partners, as I say. Then the equipping, doing the training, all those trainings that Michael mentioned, Focus 1000 and civil society, we are part of it. And then, finally, we'll be doing the introduction. We are going to be integrating with the birth dose with BCG, and then later on, see how we can move with the implementation. Next slide, please. So we have a lot of opportunities. As Michael said, we've done series of vaccination over the years. So in our community engagement, we use the experience of polio to let people know that, look, vaccinations are effective, vaccines are safe, and, they create impact. Vaccines can save life. So we saw it with polio. We saw it with COVID-19. We saw it with measles. We use these ones as examples because most times you have resistance, you have misinformation, especially with the social media now. So we try to use the experience of positive vaccinations to lay the foundation for the HepB vaccine. Next slide, please. Yeah, of course, there are challenges, but what we have done is to make sure we clarify roles and responsibilities. There was delay in feedback, in terms of the materials. There are anticipated challenges, about the doses and, addressing the concerns, for multiple vaccines. Mothers are saying, oh, maybe there are too many vaccines. But we are still trying to explain to them that, all of these vaccines, they are safe And if there are side effects, that is why we are improving on the, AFI, so that, we can monitor and see if there are any adverse events, the report, and then we take immediate action. Next slide, please. Key activities, we started with the introduction of the strategy. We developed our strategies and provided it. We supported the CAP studies, even though it was a very short one. It had to be integrated into the existing projects that was going on. We hope we'll be able to do a more in-depth CAP studies to capture the concerns, the fears, and the aspiration of community members. We are involved in the supervision of the training activities, and then also we host coordination of partners. Next slide, please. Deliverables, position and concept notes. For whatever we do, we make sure, it's clearly stated in our concept notes. The trainings that we do, the relevant position papers have all been developed. The CAP studies, we've also, developed the tools, and we've supported the conduct of the study on a small scale. As I say, we will be doing it on a larger scale. And then coordination, all these meetings, the TWGs, we make sure that everything is fully documented so that we can see the lessons learned. Next slide, please. So what are the lessons learned? The messages, communication through trusted voices. We are trying to see how we can work with the religious leaders, the traditional healers, the market women, the media, because we believe that, in communication, we always say the message is important, but the messenger is equally important. So we try to get trusted voices. We try to get early buy-in. We don't wait to use communication at the end. I'm very happy with HepB. Communication, community engagement is coming right from the beginning, because most times we use community engagement as a spare tire in your car. You only use it when you need it. But this time, communication and community engagement is one of the 4 tires, and we are very happy about that. We are also looking at the rumors. We track the rumors and try to respond to them adequately and timely. Next slide, please. And I think that's
the
it.
last slide. Yes.
Yeah, thank you so much. Yeah.
Thank you, Michael. Thank you, Mohammed. If anyone has any questions for Michael and Mohammed, as well as their rollout of Hep B birth dose in Sierra Leone, please feel free to put your questions in the chat, and then they will make sure to respond to you as well. So let's move on to our next spotlight with Ghana. They're also moving forward with their approval of Hep B birth dose implementation, so we'd like to hear their implementation process. We'll next hear from Dr. Yvonne Nardi as well as Dr. Charles Ajay.
Hi, can you hear me?
Yes, we can hear you perfectly. Please go ahead.
Great. Thank you for the opportunity and for the kind introduction. So today, Charles and I will just go through a decade of work to be able to get to the point of implementation. Next slide. In terms of our background, currently, hepatitis B vaccination in Ghana is offered as part of the pentavalent vaccine at 6 weeks, 10 weeks, and 14 weeks. And at birth, it's the BCG and oral polio vaccine that is given. The coverage is quite good, with 97% coverage for BCG and oral polio and 95% for hepatitis B birth dose. Next slide. In terms of our positioning to introduce birth dose, currently 86% of births in Ghana already occur in health facilities, and about 13 of them still occur at home. And this would be the group that particularly needs to be reached. And the challenge would be to ensure that every newborn, including those who are born at home, would receive a timely birth dose vaccine within 24 hours. One of the key ways to bridge this gap of that 13% is to continue the efforts that are already in place through CHIPS compounds, that's community health prevention services, training community health officers, as well as ensuring that there are early postnatal home visits for those who are delivered by traditional birth attendants and in non-hospital settings. Next slide. So as I mentioned, it's been a full decade, slightly more, starting back in 2015 when the Hepatitis Alliance of Ghana began pressing the government to prioritize a birth dose vaccine. And through that time, there was also evidence from our academia partners, including Professor Eoku, who wrote a piece urging the government to introduce birth dose. In 2023 and into 2024, the Director General of the Ghana Health Service announced finally that Ghana had plans to introduce the birth dose the following year. In May 2025, Gavi approved Ghana's application, and we expected the rollout at the same time as HPV vaccination against cervical cancer. But unfortunately, in September 2025, this target was missed with the rollout of the HPV vaccination, but unfortunately, birth dose was not introduced. Continued advocacy continued. There was a stakeholders forum inviting government, different civil society groups, professional groups to be able to urge the government to continue their efforts in vaccine rollout. And finally, last month, the Ministry of Finance signed a document for the rollout of birth dose. Currently, the expanded program for immunization is in the planning phase for rollout, which they have scheduled for either Q4 of 2026 or Q1 of 2027. Next slide. Next slide. Yeah. So what are some of these preparations? The National Stakeholder Forum, which was held into a collaboration with Ghana Health Service leadership, various professional organizations and civil societies, really built consensus on what messaging would be needed, what strategies would be useful to be able to communicate effectively the implementation of birth dose. And there was discussion about a national implementation plan. More recently, we've begun efforts to work with the EPI and partners, including the Hepatitis Alliance of Ghana and the Ghana Registered Nurses and Midwives Associations, to co-develop these national messaging tools for both healthcare workers and for the general public. And the EPI is planning cascade training through a training of trainers model, targeting public health nurses, community health nurses, midwives, and many more. We've recently undertaken a pilot study in Cape Coast Teaching Hospital to look at birth dose acceptance amongst pregnant women. And what we found is that there's high acceptance and there's promising coverage when the birth dose vaccine was offered to new mothers. Next slide. So in this project, we looked at what was the current status quo, and we realized that it was mostly selective birth dose that was being practiced in our setting. We got funding to be able to introduce birth dose for free, and we trained midwives as well as public health nurses to counsel and offer birth dose to new mothers. Within the first week of implementation, when we had free vaccines available, we found that uptake was very high with coverage at 100%. We had actually planned to only have this for a short period. However, so good was the uptake that even when we didn't have any more free vaccines, the public health nurses continued to offer this vaccine at a small cost to mothers. And even with out-of-pocket payments, we found that acceptance was fairly high, around 74%. We were able to raise a little bit more funding to buy some more free vaccines, and this increased the coverage even further. So this is something that continues, and we continue to monitor week by week, although mothers are currently paying out of pocket for this vaccine, which is around just under $2 per shot. The acceptance is quite high once they are counseled. So we believe that when the government does implement free hepatitis B birth dose, uptake would be similar and acceptance will be high. Next slide. So Prof. Charles will take over.
Thank you very much, Yvonne. And this is very interesting, the conversation, because if you look at the journey of Ghana, it's been a very interesting one. So we have a lot of opportunities I think we can leverage on to have a successful implementation of HepB-BD in Ghana. Beyond the fact that we have a very robust API system, we also have the National Strategic Plan for Viral Hepatitis. We also have CHIPS compound, which of course provide opportunity for every individual at the community level to have access to a healthcare professional, particularly midwife and nurses. And the fact that we have a very well-organized civil society organization, we are very confident that these are opportunities that we can also leverage on as Ghanaians. Now, this particular slide is just highlighting some key activities that as a civil society organizations we have also undertaken through the support of the Coalition for Global Hepatitis Elimination. And it's all because we're preparing the field for a day like this that we'll be having a BEV dose as part of our national program of immunization. So what we did was to find ways to increase political will. And as Yvonne mentioned, this conversation started over 10 years ago, where we started building some kind of dialogue between key stakeholders, trying to let them know the relevance of incorporating hepatitis B BEV dose vaccine into the API. And we also used the pregnant women who are also having hepatitis B voice, just for it to be amplified enough so that people would know the daily struggles that they go through, especially when it has to do with viral hepatitis. We were very intentional about releasing press statements, also highlighting the importance of the BEV dose. So again, we also decided to target also the public. And then what we did was to create PMTCT messaging for hepatitis B using video animation in local languages. And then also started having a conversation, also what we call sensitization campaigns in churches, in schools, just to let them know that yes, hepatitis exists, and once you are pregnant, your newborn can benefit from a vaccine. Of course, as Yvonne mentioned, it's something that you pay for, but they needed to know in the absence of a national program. And then we also had posters on PMTCTs in various hospitals so that individuals can also read the details and follow accordingly. But the most exciting part of it is when we recognize that healthcare providers are the main source of information when it comes to hepatitis B in Ghana. So we decided to have different trainings for healthcare providers. Some were hybrid training, some were in person, some were also scientific sessions for midwives in particular. Now, the most exciting part of it is the fact that we launched a national hepatitis B champions competition. And this was just for the midwives to send us videos and images demonstrating that they are involved in PMTCT activities in their hospitals. And we got these selected individuals to come to Accra, which is the national capital, to receive the award. And the most interesting part of it is the fact that they came with their hospital leadership. So we gave the award to the hospital for being PMTCT friendly, and again, also the midwives who won the competition for recognition. So this is just to let us know that as a country, even though we have not introduced the BEV dose vaccination, we are very optimistic with all this platform we have created and the kind of foundation we have built. It presents key opportunities for successful implementation. Yeah. Yes. Thank you very much.
Thank you, Dr. Nardi. Thank you, Dr. J, for your wonderful presentation. And we look forward to a successful rollout in Ghana. And we're happy to share any updates later on in the year. So let's move forward to our next country spotlight of Tanzania on securing policy and financing commitments. So we'll have Huruma AIDS Concern and Care, as well as Tanzania Health Alliance with the joint presentation, sharing a few advocacy strategies that contributed to their recently adopted policy for HepB birth dose in Tanzania. So please, Lugano and Enoch, we're ready for your presentation.
Yeah, thank you. So, hi everyone. I, Lugano Rogers Monsaso from Hakoka, with my colleague, Enokis Jone from THA, from advocacy to the poorest, Tanzanian journey to hepatitis B birth dose adoption. Next. Why hepatitis B? But those was the national priority. First is sort of the annually new infection, where it's sort of about approximately the 9,948 the newborn who are infected annually. And the second is sort of the lifelong, where most of the children who infected at birth, 90% at least to develop the liver diseases like cirrhosis and liver cancer. And also currently within our nation, hepatitis B vaccination is provided. It starts with 6 weeks, where it's provided at the pentavalent, whereas we are just protecting the children from birth to the day of 42. But also, when you see the mortality rate is at 14.4, which is highest even to compared to the WHO targets. Next. What are the key challenges? The key challenge first is sort of the competing has priorities, whereas the hepatitis since 20 and 23 were incorporated into their national AIDS, STI, and hepatitis control program. But in terms of the police attention and resources, we can find that it's lagging behind compared to the HIV, TB, and malaria. Whereas most of the intervention, you can find that are most integrated from the HIV integration, but not only. There's no any budget has been allocated specifically for hepatitis B. And limited police makers awareness, where as we know that the hepatitis B is sort of this asymptomatic, and where underestimated on the burden of the mother to child transmission, whereas it was not easy to put it into more consideration. Financing constraint, whereas as you know that on introducing the new vaccine requires a sustainable financing beyond the external donor support, whereas the time where we meet with the Minister of Finance, there were more curious on the sustainability. So by doing so, they need the more evidence like economic modeling or the investments, just case investments in order to be sure on that sustainability. The need for the strong evidence, whereas at the previous we were lacking most of the data on based on that specifically for Tanzania, disease burden, feasibility, and the cost constraint, where through the economic modeling report, we are provided more briefly on the investment case. And the multiple stakeholders coordination, whereas before there were no the joint voice at the national, across the national partner and the civil society, which was a challenge before. Next. On the building the case we changed. First, we started with the identification of the key just decision makers and the champion, whereas we did the Ministry of Health, the WHO, and the UNICEF on the technical support on how we can move together on the introduction of the hepatitis B dose, where the member of the parliament and the clinician were are the champion who were identified to mostly the parliament floor in order to win the securing of the hepatitis B dose introduction. But also coordinated the civil society efforts lead to the coordinated national voice, whereas all the governments, the civil society, we came together with the same voice on the elimination of the hepatitis among the children through the hepatitis B birth dose vaccine. Alignment with the global and the national police, whereas the WHO recommendation on the hepatitis B birth dose, but also 2023, the NITAG endorsed the hepatitis B birth dose, whereas the 2023 also the NASHCO just named it as the priority. But also within the guideline also covered the exposed infants to be more into consideration of the vaccination at birth. Whereas even the national strategic of 2026 to 30 also included the hepatitis B birth dose. What we're missing was just the budget, timeline, and the political will. But also we managed on developing the different message based on the audience intended to be reached, such as the technical report, economic modeling for the technical team, but also to the member of the parliament, we were developing the different messages which were so plain with the language which was very easy for them to understand it. But just on the engagement of the Ministry of Health, Parliament, and the immunization partner, we had a series of meetings with the member of the Parliament committee 2 times, but also the Parliament Health Committee chaired the meeting with the Minister of Health and the other partners, where we were more in the position to discuss more and show how the investment case is and the policy briefly, which were very easy for them to be convinced for an introduction of the hepatitis B birth dose in Tanzania. Next. Okay, we use the different evidence to influence the policy. First is sort of the prevalence among the pregnant women at 4.72%, but also the newborn annually infected with hepatitis were approximately 9,948, but also how it is preventable. Hepatitis B birth dose at birth at 90%, but also for the people who are living with hepatitis B, only just less than 1% receiving the treatment. But also the returning on the investment of 1:16, but also the Gavi cost recovery through the Gavi 6.0 on the introduction of the vaccine, rollout campaign, and implementation to that just 80%. But also sharing the experience from other countries where 142 out of 194, they have already introduced the vaccine. So behind every famous argument we have made, first we will put more into consideration the return, such as 1 invested T-shillings, it gives the return of 16 T-shillings, but also affordability, that the budget took just less than 0.15% of the whole health budget. But the urgent to use this window of Gavi, whatever we closed it will take us some years till 2030 in order to get the support from Gavi. Thank you. Next. On building the political commitment, we have started with planning joint ACOCA and THA and how we can start winning the political changing the political will on the hepatitis B birth dose. Whereas we started with the Ministry of Health technical consultation meeting, then we have followed with the Parliament's health committees. But also we have some of the technical meeting with UNICEF in order to get some updates for unified voice or agenda on the hepatitis B birth dose. Next.
Hi, Lugano. I just want to give you a friendly reminder that you have 2 minutes left, and then we have to move forward to the next spotlight.
Okay, thank you. So at the end of the day, the government's commitment uh, on the T shillings, 38 billions were allocated. This goes alongside the cold chain infrastructure investments were approved. The National Public Education also campaign were committed, and they were committed to utilize the GAV6 funding window. Thank you. And next one, check your position, please, for the next slide.
Oh, thank you. Thank you, Lugano, for clearly taking us through Tanzania's advocacy journey and the policy milestone. So I will now focus on what made this success possible, by key lesson we learned and what comes next as we move forward from policy to implementation. So this achievement was not work of one organization. It was the result of a strong partnership between ACOCA and CGHE, whereby ACOCA lead a technical component by developing economic model, generating evidence, preparing of policy brief, and supporting communication material. On the other hand, THA coordinated a national advocacy, mobilized civil society organization, engaged stakeholders, and strengthened implementation readiness, and worked close with the Minister of Health for the next process. By combining those technical expertise with a coordinated advocacy, we were able to present one strong national voice with significant strengthened political commitment for hepatitis B birth vaccine. So next, as we reflect on this journey, several important lessons emerged. Next slide. Our biggest lesson is that policy change cannot be achieved by one institution alone. It requires collaboration between government, civil societies, development partner, and technical expertise. So secondly, locally generated evidence made a real difference. Decision makers responded not only to the health impact, but also to the economic value and the investing in prevention. Continuous engagement with the Parliament, Minister of Health, WHO, UNICEF, and other partner helped maintain momentum through the advocacy process. At the same time, we recognize that the implementation still faces challenges, including sustainable financing, competing health priorities, and maintaining the coordination among all partners. Those lessons guide us on our next phase of work. Next slide. So what next after those all the lessons, after all those the key activities? Next is to ensure the government commitment is the only beginning of the next activities. And our next priority is to ensure successful implementation of the hepatitis B birth dose vaccine across Tanzania. This includes maintaining high-level political engagement, supporting the Minister of Health during the implementation, following up on the Gavi 6.0 process, and ensure sustainable domestic financing. We also aim to document our experience and share those lessons with our neighbor countries that are working toward introducing the birth dose vaccine. And our goal is not to achieve policy adoption, but to ensure that every newborn is protected from hepatitis B from every day of newborn. With that all, I will leave you with one final message that strong partnership, strong strategic advocacy, and evidence-based decision making can turn policy goal into government action. Thank you very much for your attention, and I look forward to your question. Thank you, Queens.
Thank you, Enoch. Thank you, Lugano, and congratulations to your organizations as well as to Tanzania for your recently Hep B birth dose policy approval. We're happy to share any policy briefs as well as IEC materials from both organizations on our website, and we'll also post them on our webinar webpage. In the interest of time, let's move forward to our next country spotlight of Kenya. They'll be advancing policy adoption through stakeholder engagement. We'll first have presentations from LVCT Health, followed by Hoywick. So Duke, whenever you're ready, we're happy to hear your presentation.
Yeah, thanks, Quincy. Confirm you can hear me.
All good here.
Yeah, so my name is Duke Sangara from LVZT Health in Kenya. I'm the technical lead for sexual reproductive health, and I will be taking you through the work that we've done through the support of the Coalition for Global Hepatitis Elimination. I think because of time, we'll just move to the next slide, and I will pause my video to save on my bandwidth as I present. Yeah, so as I mentioned, I work with LVZT Health. We are an Kenyan organization, and we work using a unique model called research policy and practice, meaning that we conduct research, do policy work, and implement health programs to be able to inform policy changes. So in terms of Kenyan background, so our national prevalence is at 3 to 5% based on the source document, but WHO quotes 4.4% prevalence, meaning that hepatitis B is common, and we have around 890,000 people who are living with chronic hepatitis B. So we have around close to 11,498 persons who are dying because of hepatitis B complications. And that's why I likened this virus to the Mojo Jojo cartoon. So just to look at perspective, Kenya is yet to introduce the hepatitis B birth dose vaccine, but pentavalent is administered at 6, 10, and 14 weeks as part of the schedule. Next. Yeah, so in terms of where we are as a country in Kenya, we can acknowledge that progress has been made so far. We have had a number of technical engagements thanks to the support of the coalition and other partners, including engagement with the Ministry of Health, the National Vaccine Immunization Program, and NASCOP, who supports viral hepatitis and STI interventions. Currently, within the Gavi 6.0 consolidated application, Kenya hasn't included hepatitis B birth dose vaccination, but we continue to engage to see when that could be incorporated. But even as we work towards that, we are currently working with private sector and public facilities to ensure that providers are informed about the hepatitis birth dose vaccine and possibilities of ensuring its provision within the social health insurance fund. Next. Yeah, so I think based on that statistics, then hepatitis B birth dose is a priority in Kenya, considering that we know that 90% of children who acquire hepatitis B birth dose vaccine at birth have a risk of an higher chance of progression to chronic hepatitis B and even liver cirrhosis and liver cancer. So then because of that, then introduction of the birth dose is a priority and should be done in a matter of urgency to be able to ensure that we eliminate vertical transmissions. Next. Yeah, so in terms of, so I think as Dr. Ward already highlighted, this collaboration is through the funding of the coalition and support from US CDC. So the project in Kenya basically focused on promoting timely hepatitis B birth dose vaccination through community sensitization and advocacy for policy change. So we'll be highlighting what we did in this project. Thank you. Next. So in terms of what activities we engaged in, build support through stakeholder engagement. So we tiered our engagements at 3 levels. So first, we targeted national policy, where we presented hepatitis B virus burden together with our folks from the Ministry of Health to ensure that everybody is aligned in terms of readiness for introducing the bird dose vaccine in Kenya. We advocated for hepatitis B bird dose inclusion in the recently launched integrated guidelines for management of HIV, STIs, and viral hepatitis, which was launched in March this year, which provides a recommendation for universal bird dose vaccination, which was a significant win for the work that we did. We also engaged the EPA program, regardless of the concerns around readiness and costing for the vaccine, to be able to have a consideration for introducing it within the coming days. So we also participated within the technical working group at national level, the National Cancer Control Program, immunization, and viral hepatitis. The second component that we supported, we engaged professional bodies and we engaged midwives in a webinar that reached more than 210 practitioners with information around hepatitis B and birth dose, because the people who engage with pregnant women and their infants within the 24 hours of birth. We also had a webinar with neonatologists and pediatricians across Kenya, around 151 audience, also to discuss about practical ways to ensure increased uptake of the birth dose vaccine. For civil society engagement, we believe that CSOs, we can barely do much, and we trained 25 individuals who are on treatment for chronic hepatitis as advocates to be able to champion advocacy for introduction of the hepatitis B birth dose. We also engaged pregnant women during the commemoration of the International Day of the Midwife at Machakos County, and did health talk to pregnant women about hepatitis B birth dose vaccination. Next. Yeah, so in terms of photos, so the first photo is during the launch of the integrated guidelines for management of HIV, STIs, and viral hepatitis, together with the hepatitis SOM that was launched in March during the Health Integration Summit. The next photo, you can see engagement with nurses and midwives. The third photo is the training of the advocates that we engaged, and we also ensured that they are able to be linked with the national technical working groups to continue with advocacy for sustainability and continuity. We also attended the integrated testing workshop at the sidelines of the World Hepatitis Summit in Bangkok, and had a community networking session in that forum to be able to highlight the work that we have done for those introduction engagement in Kenya. So the second line, engagement with pregnant women with health talks around birth dose, and the last photos is webinars that we supported together with Midwife Association of Kenya and Kenya Pediatric Association. Next. Yeah, so the next slide is about consolidating this work. So through the support of the coalition, we have ensured that at every level, we have conversations around birth dose and why it should be a priority now. We acknowledge that currently we have an higher coverage of targeted immunization, but are working with various partners to ensure that we document current efforts for universal birth dose vaccination in the country, to be able to build a case even as we prepare for universal introduction within the EPI schedule as we continue to engage. Next. So in terms of recommendation for other countries, in terms of engagements, we realized that advocacy at the table bore more fruit in terms of engaging with government at the technical working group level and at strategic forums to be able to advance this agenda. Like on 28th, we commemorated the World Hepatitis Day in one of the counties in Baringo, and a number of commitments and engagements from government and partners in terms of supporting universal birth dose vaccination in Kenya. Also engaging practitioners who are the frontline workers, nurses, midwives, and doctors, because they are the first point of contact. It's also very key to ensure that we mobilize communities, because they are the people who could be able to advance the message and get it home in a better manner, to ensure that there is quick adoption of the birth dose vaccine. So I think basically bringing the community's voices so that they can bring perspectives of how they are affected with hepatitis B. Next. Yeah, so thanks for your time, and we hope that we'll work together to build a future of equitable health systems together and ensure that every newborn has access to the universal birth dose vaccine in Africa and beyond. Thank you.
Thank you, Duke. Zachary, if you're still on the line, we can quickly run through the activities and spotlights of Hoywick.
Thank you. Good day, everyone. On behalf of the Humanity for Orphans, Youth and Widows Initiatives Kenya, thank you for this opportunity to share our progress in advancing hepatitis B birth dose in Kenya. Our work focus on strengthening policy advocacy, generating local evidence, and integrating maternal and newborn health intervention to ensure every child has an access to hepatitis B birth dose within the first 24 hours of life. Allow me to share how we are building the case for hepatitis B birth dose in Kenya by advancing policy through stakeholder engagement, evidence generations, and maternal newborn health intervention. Thank you. Next slide, please. Hoywick has continued to advocate for inclusion of hepatitis B birth dose within Kenya National Immunization Program. Through this collaboration with the Ministry of Health, county government, and health partners, we are continuing promoting a policy dialogue that links community priorities with national decision-making and strengthening county ownership of the intervention. We are continuing developing strong local evidence to guide national policy. These include updating our, Kenya hepatitis B policy brief, developing an interactive data dashboard, and refining disease burden and cost-effectiveness model. These tools will continue to support the informed decision by the government, donor agency, and development partners. Our work has already demonstrated that community engagement is key and very essential for successful implementation through stakeholders meeting and field activities. This has seen strengthened awareness among healthcare workers and community leaders while distributing clean birthing kits that has promote safe delivery and prepare newborns for timely vaccination. Next. The recent roundtable meeting held with the sub-county officials successfully brought together health officials, facility managers, and community representatives to further discuss the integrating hepatitis B into routine immunization services. This meeting has produced a practical commitment for tracking birth dose administration and demonstrated that local dialogue can effectively support national policy implementation. Through the national policy synthesis, building on one of our roundtable meeting experiences, HOIWIC is preparing for a national roundtable that will convene the county government, ministry, parliamentarians, and development partners to consolidate lessons learned, strengthen national coordination, and mobilize political and financial support for hepatitis B introduction. Through our partnership with the Birthing Kits Foundation Australia, clean birth kits are helping improve safe child birth while creating an opportunity to educate mothers and families on the importance of administering the hepatitis B birth dose within 24 hours after delivery. This integrated approach seen and has already strengthened both maternal and newborn health services within our country. HOIWIC plans to distribute further 5,300 clean births kits across Nairobi, Kiambu counties. This expansion will further strengthen community readiness and improve safe delivery practices and support timely newborn immunization in both rural, informal settlement and rural communities. We continue to develop cultural appropriate information, education, and communication materials that addresses misconception about infant vaccination and encourage early health facility delivery through community health promoters, media platform, and the recent World Hepatitis Day activities. We are increasing public awareness and demand for hepatitis B birth services. To further strengthen healthcare workers' capacity, HOIWIC has developed a visual learning tool that summarizes best practices for hepatitis B delivery. We also plan to host, national learning webinar or meetings where counties can exchange experiences, share lessons learned, and promote continuous professional development. Through the economic investment case, preventing hepatitis B birth is a very highly costly investment, and relatively a small cost of providing the birth dose vaccine can prevent long life chronic infection and significantly reduce the future treatment cost, making hepatitis B a sound investment for Kenya's health system. Through our updated hepatitis B policy brief, this brings together the latest specific evidence, data, and strategic recommendations, which provides a practical roadmap for integrating birth dose for vaccine in the national immunization policy, and will also further support upcoming advocacy and engagement. Our upcoming, within the next few months, HOIWIC will finalize the policy brief and data board that will also help us in our roundtable meetings in upscaling community intervention and complete economic analysis and contribute evidence for Kenya next national immunization strategy and the Gavi application process. Next. Next slide.
We have the conclusion slide up.
Yeah. We are developing a real-time monitoring dashboard that will track birth dose readiness, vaccination coverage, availability, and service performance across health facilities. This platform will further support timely decision-making and improve program planning at both national and county level. In conclusion, HOIWIC believes that a strong partnership, local evidence, community engagement, and integrated maternal newborn health intervention are essential to introducing hepatitis B birth dose in Kenya. We further thank the Coalition for Global Hepatitis B Elimination, Liverpool Health Facility, the Ministry of Health, Birthing Kits, Global Health Action, and all our partners for their continued collaborations. And together, we can protect every newborn from hepatitis B and build a healthier and hepatitis B-free generation. Thank you so much, and we invite our participants to follow us in our social media handles. Thank you, and good day.
Thank you, Zachary. Thank you, Duke. In the interest of time, let's move forward to our next spotlight of Nigeria. So we'll have a presentation from Dr. Ajis of the Civil Society Network on Hepatitis Nigeria, talking about building a national community of practice.
Good day, everyone. My name is Dr. Ajis Eliaza. I am pleased to represent the Civil Society Network on Hepatitis Nigeria. Today, I will share our experience in building a national committee of practice for hepatitis B birth dose in Nigeria, which will be highlighting how collaboration, knowledge sharing, digital innovation, and community leadership are helping accelerate hepatitis B birth dose implementation. Our project demonstrates the strengthening partnerships and creating platforms for continuous learning can support countries in moving closer to the WHO hepatitis elimination targets. Slide 2, please. Here, why Nigeria's experience matters. Nigeria has one of the highest hepatitis B burden globally, with approximately 18.2 million people living with chronic hepatitis B. Each year, over 77.5 million babies are born, which makes Nigeria one of the highest birth cohorts in the world. Making timely birth dose vaccination critical is in preventing mother-to-child transmission. While Nigeria has achieved about 52% timely hepatitis B birth dose coverage, exceeding the WHO interim target, there still remains a significant gap to reach the 90% elimination target. This challenge provided the motivation for establishing our National Committee of Practice. Next slide, please. The opportunity. What challenge we were trying to solve. Before this project implementation varied usually across states. There was limited coordination amongst government agencies, civil society organizations, and implementing partners, resulting in fragmented advocacy and missed opportunities for shared learning. Our response was to strengthen state-level advocacy, build technical capacity, promote integration of hepatitis B birth dose into maternal and newborn services, as well as improve collaboration across stakeholders. Next slide, please. Here, we have building the National Committee of Practice. A key innovation was establishing Nigeria's online committee of practice. The platform brings healthcare workers, policymakers, researchers, civil society organizations, and partners into one collaborative space. Members can access training materials, participate in discussion forums, learn from high-performing states, as well as share implementing experiences. This has created a sustainable platform for continuous learning and collaboration across Nigeria. So on this platform, of course, members can actually share ideas, can get materials, as well as can get access to IEC materials for trainings. Next slide, please. Public websites. Our public website serves as the gateway for awareness and engagement because it is well known that hepatitis B has little awareness globally. So with our country, with so much high population, we figured a way that the only way to actually start tackling this is to actually go really public online. So we have a public website whereby whereby it serves as the gateway for awareness as well as engagement. It produces educational resources and gives visitors the opportunity to donate, volunteer, partner, or advocate for hepatitis B elimination. The website helps public awareness while encouraging broader stakeholders' participation. So you can do well to check out our website. Next slide, please. Here we have the resource library. The resource library provides open access to advocacy toolkits, IEC materials, policy briefs, guidelines, recordings of webinars, and presentation templates. There, in the resource library, you can find all this. So all you just have to do is to go on the resource library and you can download all of this, making these materials freely available, ensuring that organizations across the whole 36 states of Nigeria can use standardized resources to strengthen advocacy and implementation efforts. Because by using standardized resources, we can easily disseminate information across the 36 states of Nigeria. Next slide, please. Coalition portal. Beyond the website, we developed a secure coalition portal. This coalition portal, members can collaborate within state-specific workspaces, share updates, coordinate activities within their states, and monitor progress. This platform, this portal is a real-time portal because everything that actually happens on the portal, it happens real time. You can actually track activities in states. You can follow up with progress reports, and then as well, you can actually interact and make inputs on the platform. The platform allows each state's coalition to organize its activities while remaining connected to the national network. Next slide, please. All right. So here we have the data dashboard and communication tools. Here, part of the portal, we have, which includes a live dashboard that tracks all coalition growth, state participation, and progress towards coverage activities. Here, all the activities can be actually tracked once you actually join the portal. And like I said earlier, it is real time. It is built in directories and messaging functions which enable members to communicate directly without relying on external applications. So here, members within the 36 states can actually use, not just in Nigeria, even within Africa, can actually be part of this network. And without any special application, you can actually interact within yourselves. You can easily access materials which can be used for advocacy. These digital tools have significantly improved coordination amongst partners in Nigeria. Slide 9, please. Okay, here we're talking about the key project activities. The online platform is supported by extensive field activities because definitely as good as you have the online platform which you use to actually network amongst the coalition members, and extensive field activities is also very, very important. Part of the things we actually have on the field included baseline assessments. We had a baseline assessment which actually helped in assessing the real issues from the facilities, trying to assess to understand the real issues causing delaying or total absence of timely hepatitis B birth dose within the first 24 hours of life. Aside the baseline assessments, we had stakeholders engagement, establishment of expert advisory committees, healthcare workers training, which is ongoing, community awareness campaigns, which is actually ongoing too as well, policy advocacy, peer learning exchanges, supportive supervision, monitoring and evaluation, and then lastly, we have scale-up of plans. Together, these activities strengthen implementation, both online and the ground. So we have both online activities and offline activities where they complement each other. Next slide, please. Okay, so here basically we're talking about the impact we've made so far. Within a relatively very short period of time, we have established a functional national community of practice which connects 6 pilot states together. And in the shortest possible time, with as we actually go on, we are trying to actually see on how sustainability will be made so that we can actually sustain these 6 states as well as expand to the other 30 states. We have improved collaboration among stakeholders, completed baseline assessments. We've launched the online platform, which you can actually do well and check for the online platform. You can sign up on the online platform, and then be part of it. We've developed standardized advocacy materials, which you can actually find both on the website and on the platform. We've also increased participation through webinars and created a strong foundation for national expansion. These achievements demonstrate the value of combining both digital collaboration with field implementation. So with a country of very high population as my country, we figured that the only way to achieving certain goals in hepatitis B, bed dose scale up is to combine both online digital collaboration with the field implementation. Next slide, please. Okay, here basically we'll be talking about lessons learned. Several important lessons have emerged, coming from strong partnerships, which remains the foundation for success. We have collaborative partnerships with almost all the stakeholders we actually, the civil society network, work with. Peer learning allows states to rapidly adopt successful practices. Digital platforms sustain collaboration across geographical dispersed locations. So it doesn't really matter where you are, as long as you can actually be part of our digital platform, you can actually follow up real time as regards what is happening in states across Nigeria. Evidence strengthens advocacy, while continuous capacity building keeps healthcare workers updated. This also training of healthcare workers, which was really a part of what we had to do. We noticed it was actually important that the health workers actually have not just the knowledge, but the very right knowledge, so that they were able to disseminate information as regards early time-based dose vaccination. Finally, sustainability should be integrated from the very beginning through government ownership. So we're trying to actually have the government take charge of projects. Next slide, please. Here, we're talking about Nigerians' experience and a model we have actually created that other African countries can actually emulate. Nigerians' experience provides a practical model that other countries within Africa can adopt. The approach is cost-effective, digitally enabled, evidence-driven, real-time, and promotes collaboration between government, civil society, and development partners. So in one house, you can have all to actually access and track activities of scale, which are modeled towards scaling up of hepatitis B bed dose vaccination. Most importantly, it complements existing immunization programs, which aligns with WHO hepatitis elimination strategy. Next slide, please. Okay, so here, what we're looking ahead to do, we're looking forward our vision, which is to expand from just the 6 pilot states to all extra 30 states and the capital in Nigeria. We will continue strengthening state ownership, upgrading the online platform, expanding workforce training, improving data systems, increasing community demand, mobilizing sustainable financing, and positioning Nigeria as a model for other countries. Next slide, please.
Thank you so much, Dr. Idris, and congratulations on your platform. We are happy to share the link in the chat as well as in our roundup on our webinar webpage. We apologize for going over time, but we have one last country spotlight of Zambia. So to those who have to hop off and to attend to something else, we will share the webinar recording as well as the presentation slides. So let's move forward to our last country spotlight of Zambia. We partnered with HEP Initiative Zambia as well as Botswana Integrated Services Organization, and they'll be talking about building awareness and demand for hepatitis B birth dose within Zambia.
Yeah, thank you very much. Good day to everybody. I think we can we'll start Wafano, Integrated Services Organization. Next slide, please. So we briefly is about ourselves. Wafano, we're a non-government organization that was established in 1996 as a response to increasing HIV and TB and over and whatever children in Zambia. And our vision is healthy, inclusive, and self-sustaining communities. Our mission is promoting sustainable development in communities most affected by HIV in Zambia, focusing on vulnerable women, children, and young people by promoting them access to health, social and education services, facilitating sustainable livelihood programs, and fostering community engagement, networking, and advocacy. Next slide, please. So for this program, our focus as Wafano will focus on what we did as creating demand in the community and raising community awareness on the birth dose in our country. So we call health check during the under 5 clinic to educate community members on transmission and prevention of hepatitis B. Then we conducted antenatal education to pregnant mothers on the importance of birth dose, and we conduct community engagement meetings with religious community leaders to create awareness demand for birth dose vaccine. I think for Zambia, the hepatitis B, it's a new thing, and I think a lot of Zambians, communities, even medical personnel, they are not aware about hepatitis B in our country, and we're trying to make sure that people are aware about how this can be transmitted and how the prevention of hepatitis B through birth dose vaccines. Next slide. Next slide, please. So progress that we have made by engaging a lot of our community members, we have realized that, as I said earlier on, that this is new in Zambia and a lot of people are not very much aware about hepatitis B. And so we have seen through the engagement with the communities, we have realized that people have now our community knowledge about hepatitis B, increased stakeholders awareness, increasing requests for more information. People have been coming to our center so that they can get more information about hepatitis B. We've realized that there's a lot of discussions. Now, I think we've raised a lot of discussion about hepatitis B in our country at the facility level, at the sub-district level, and even at the national level. It has brought a lot of new partnership because as Wafano, with our colleagues from the HEP initiative, even government departments, we've realized that we have created a new partnership so that we can have a strong voice towards hepatitis birth dose vaccines. Also, strong ministry engagement. We've been engaging the ministry at the facility level and at the sub-district level. And with our partner HEP initiative, we've engaged the ministry at the national level. Next, please. Next slide. So the lesson learned is one is the consistent stakeholder engagement. We've realized that as we continued engaging the stakeholders, we realized that people were getting a lot of information and we're sensitizing people, are becoming aware. Even the ministry are aware of the importance of having the birth dose to be included on the vaccine that we're providing the country is very, very important. The secondary Second lesson learned is the community voices. We realize that when the people at the community have got the voice, we created demand, and definitely the government and other stakeholders will come in so that we can introduce this vaccine that is needed in our country. The other one is tailored advocacy messages. I think our advocacy message has been tailored according to the group that have been engaging. There's messages for the women who are pregnant. There's messages for the women who are breastfeeding. There's messages for the community leaders, messages for the church leaders, and messages to the health staff. And this has made sure that people are able to get the message according to the subgroup that we are targeting. The other one is sectoral partnership. This has really helped because we are not working as Wafano alone. We are working with other partners, and this thing has made us our voice to be strong. The next slide, please. Our next step, that's what we are looking forward is we need to continue advocating, make sure that the government, the community, we work as a team and we address the issues of especially the birth dose of to be included in our vaccines in our country. We need to expand our community awareness because we are at only what we call Chipata sub-district, just a small portion of our sub-district in Lusaka, where we are doing these sensitization, and we are looking for that we can expand in Lusaka as a district and in other districts across the country. The other one is strengthening evidence base. We need to create a lot of evidence by doing a lot of research. The other one is building political champions. In Zambia, we are having elections after next week. And after elections, we need to identify who will be our MPs, who can be our champions as we are addressing these issues. The other one is prepare for policy adoption. We need to make sure that as a country, we have the policy that is guiding our implementation of activities where hepatitis B is concerned. The other one is support integration into EPI. It's very, very important as a country. We've engaged the EPI team and other Ministry of Health officials. We need to make sure that this issue of hepatitis B birth dose vaccine is integrated into our EPI programs. Next slide, please. So our colleagues from HELP initiative, they will take up. HELP initiative will take up, please. Thank you.
Maybe if Tamaway or Mawape wanted to start with the presentation.
Okay. Thank you so much for this opportunity. My name is Tamiwe. I'm speaking on behalf of HEP Initiative. So HEP Initiative Zambia is just basically a patient-led, community-driven organization. Our main purpose is just our dedication to reducing the impact of viral hepatitis across the country. We work alongside the Ministry of Health and other partners, including other CSOs like Wafano had highlighted, including other government officials such as the ZNPHI, the WHO, UNICEF, and of course, the Coalition for Global Hepatitis Elimination itself. So why our work is actually important is because it has been established that hepatitis remains a very big problem in Zambia, about 5.6 prevalence in adults between the ages of 15 to 59. We have mother-to-child transmissions that remains the leading cause of lifelong hepatitis here in Zambia. And though Zambia currently provides hepatitis B vaccination starting from 6 years old, 6 weeks, it leaves newborns completely unprotected during the most crucial period. So the introduction of the birth dose offers an opportunity for us to prevent thousands of new infections and future liver cancer deaths. The next page, please. So in terms of our advocacy activities that we realize, we identified several gaps. For example, lack of policy framework, very low public awareness of hepatitis B. I think this is something that has led to a lot of our work, a lot of development in terms of our advocacy efforts, in terms of engaging different institutions, in terms of development of our IC materials. There's been very limited understanding of the hepatitis B birth dose among decision makers. We realize as HEP initiative that if we only do the advocacy and actually engage the people who make the policies, our efforts will not result into actual policy changes. And so we have been engaging the people who actually make the policies, including the Committee for Health and the National Assembly that we've had several engagements with, to be able to see how we can actually integrate the introduction of the birth dose into our actual policies. There's been also competing health priorities here in Zambia, as we know that a lot of advocacy has been done around HIV, tuberculosis, and syphilis, but hepatitis has lagged behind very much. And so we acknowledged this, and we have been engaging a lot of government officials just to see how we can get the voice out. We have also noticed the stigma and misconceptions, especially in the rural areas. Also here in Zambia, as hepatitis is known as a family disease. And so a lot of women, especially those who are pregnant and about to give birth, shy away from any kind of testing, any kind of help seeking, because they are afraid of the stigma that still comes from hepatitis B. There's also limited advocacy and community demand. There's limited funding. Obviously, we have people that come through, like the Coalition for Global Hepatitis Elimination, that has come through with funding. But in terms of local funding, there's very little funding that goes to hepatitis B fight. And so that brings a barrier for us. For example, when we do make efforts to do the advocacy, we find that sometimes we may have to bring forward our own funds, whether it is to get the actual birth dose to administer to a pregnant woman, especially in more remote places. There is need for more local data. I think in our efforts to get more data, when we engage the WHO and UNICEF, we found that though we may all have some data on hepatitis B and its prevalence and the age groups, there is no interaction between these institutions. There is no interaction in terms of information, in terms of work done, in terms of how far are the gaps found. And so we found that sometimes our efforts can be repetitive because there is limited information that's actually published in public forums for the government to allow people to actually know where we stand on this. There's also need for policy processes to be faster. They take time. So whilst something can be urgent, it takes the government to sit, and the bureaucracy takes about a year or two for anything to actually materialize. Next slide, please. So our advocacy journey, together with the Ministry of Health, Wafano, Integrated Services, organizations and partners, we developed the hepatitis B IEC materials that you're able to see there. So we conducted several community awareness campaigns through Lusaka and several other provinces as well. We engaged the Ministry of Health leadership because obviously the Ministry of Health is able to give us credibility here in Zambia to be able to speak on whether we are following the proper guidelines in producing these actual materials. We also did learn a lot from the work done in the HIV space in terms of wording, in terms of language, in terms of interpretation of information, to allow the common Zambian to be able to understand the information that we're bringing through these IEC materials. So we work together with the EPI, we work together with WHO, the UNICEF, and other partners just to be able to ensure that the information that is brought through does not make people shy away from coming through. And so we were careful with our wording. I think also we just like to commend the coalition for coming through as well, which is helping us in the development of these IEC materials. So we also went further to train healthcare workers. We scheduled our trainings from different districts, different provinces, just to be able to train healthcare workers, to train volunteers as well. We had volunteers come through We had midwives come through, those that, even though home births are discouraged, we did still train those as well who participate in home births for the delivery of the birth dose. We also use social media. We had several radio engagements just to be able to put out the information for the need for the birth dose, for the advocacy work that we're doing, and calling through other partners to come through on board, and also just to encourage community dialogue. And this helped us amplify the patient voices as well. I'd just like to state that with this advocacy journey, we did a lot of stakeholder mapping as well, because we realized that in this journey, advocacy alone is not enough. We were supposed to be able to create a follow-through, for example. So we realized that if we begin just with advocacy and end with advocacy without us following through to talk to policymakers, to talk to the people that actually administer this, including the Zambia Association of Obstetricians and Gynecologists, the Midwives Association of Zambia, the Zambia Pediatric Association, just to build that clinical support for the birth dose as well. I think that's something that we really focused on in the last few months as well. I think we also focused on conducting community awareness campaigns with our media interviews and our social media advocacy, and just promoting patient-centered advocacy by just ensuring that the experiences of the people who are actually living with hepatitis contribute to the national decision-making as well. Next slide, please. So in terms of our key achievements, I think hepatitis B birth dose is now a part of national discussions. Lucky for us, we have had a very good relationship with the Ministry of Health and with the permanent secretary there. And so we've been able to push the agenda to say we need to make this a part of our daily conversations as well. And so hepatitis B birth dose has now become part of the policy framework, in that now they're able to administer it as part of a routine antenatal visit. When a woman goes through for a routine antenatal visit, whether they are able to administer the HIV one, the syphilis one, hepatitis B is now being introduced as well as part of the antenatal care, and also at birth as well. So we have stronger collaboration now between hepatitis and immunization programs, as I just spoke to. We have increased stakeholder awareness as well. We have also new partnerships that have been established. Wafano is one of them. We have also established new partnerships with local CSOs and other international stakeholders that may want to come through and understand our cause. Because of the delay, I think obviously in the new Gavi funding, obviously we're still working with the old Gavi funding. We're still waiting to see the kind of impact that will have on the actual ground. And I think then we'll be able to identify the road ahead and how we can go forward in terms of advocacy for the birth dose. We have also noticed that there's now greater demand for information from health professionals and communities. It is important to note that in Zambia, the information is not there even for the health professionals. And that's why you saw earlier that I alluded to us training healthcare workers, because we noticed that the information is not there, whether it is with healthcare professionals, it's with mothers, it's with people in the communities. And so we're doing our advocacy at every level, whether it's with government institutions, we are meeting them, we're engaging them, we're having stakeholder meetings, we're doing trainings with healthcare workers, we're doing trainings at community level, we're doing radio appearances and social media interactions just to get the information out there. Next slide, please.
Hi, Tammy. If possible, we can wrap up within 1 to 2 minutes so we can maybe possibly end by 11 o'clock a.m. ET.
Okay, I'll make it quick. So in terms of lessons learned, what worked for us was consistent engagement. Once you go cold, I think the trail also goes cold. We focus a lot on patient-led advocacy, just to say that majority of the people who are actually in HEP initiative are people who are living with hepatitis B. So it makes our information more patient-led, more patient-informed. We use local evidence by going into the communities and actually talking to people and getting the information on the ground. Our macro sector partnerships actually helped us, especially with the Zambia Association of Obstetricians and Gynecologists, and just the community ownership. The more people feel as though they own this, the more they're able to come through. Next slide, please. So the road ahead, our priorities right now are just to continue national advocacy, continue engaging stakeholders here in Zambia and new stakeholders out of the country and out of the continent as well. Just expand community education, encourage them to own this fight against hepatitis B, encourage them to go through for the birth dose as well. And also just to build political champions, as it was earlier alluded to by Wafano, that our government is going through an election. So we hope as the new policies are coming through, that we'll get the same support that we have had so far, and just support the adoption of hepatitis B birth dose within Zambia's EPI program. We're hoping to build awareness. We're hoping to ensure that every child in Zambia is protected from hepatitis B from the very first day of life. I think that has been our message in the last years. Last slide. So they're just visuals of us awarding our champions and just all our interactions with the UN, with the National AIDS Council, and with all the other stakeholders, with the EPI, with the WHO as well. Yes, I think that ends our. I hope that was under 2 minutes.
No worries. Thank you. All right. Thank you so much, HEP Initiative Zambia, and thank you, Bofano Integrated Services Organizations, for your presentation. I think that wraps up our webinar today. So I would like to thank all of our presenters for joining presenting for today's webinar. As you can see, our partners are very busy in the implementation and sustaining momentum for Hep B birth dose advocacy within their countries. We invite you to fill out our evaluation poll on today's webinar. And we also invite you to stay up to date with the Coalition for Global Hepatitis Elimination through our social media as well as our email, so that you can receive more opportunities to join webinars like today, as well as to receive the materials, the recordings, the presentation slides from today's webinar. We also have a communications library that we host all of the IEC materials and policy briefs that were created since 2022 from our Hep B birth dose advocacy projects. And so we invite you to use those as a resource as well. If you have any questions for the presenters today regarding their activities as well as next steps within their countries, please feel free to reach out to us via email, and we're happy to assign those questions to the presenters so that we may get an answer for you. Without further ado, I would like to thank you all again for joining and attending today's webinar. We will post the webinar resources shortly.